For your presbyopic patients, X-Cel Contacts presents CV4, the Clear Vision 4-dimensional multifocal. The CV4 is a progressive aspheric front surface multifocal GP lens that can be fit by simply using the patient's pupil size, corneal measurements, and spectacle RX. The lens has a spherical back surface design with standard single vision curves, allowing the lens to be fit as easily as any single vision GP lens. The front surface incorporates aspheric progressive power optics. The center portion of the lens has a low eccentricity that provides clear distance vision, while the adjacent mid-peripheral area has a more rapid rate of flattening to provide near vision. The ideal CV4 lens positions centrally during straight-ahead gaze. For near tasks, a small amount of lens translation is desirable as the patient moves from far to intermediate to reading distances. When evaluating the lens fit, simply use the same fluorescein pattern assessment techniques as you would with a spherical GP lens fit. Because the lens has a spherical back surface, many of the unwanted corneal changes resulting from steeply fitting aspheric multifocal lenses are avoided. Therefore, CV4 patients are not troubled with spectacle blur after removing their lenses. The CV4 design offers optimum visual acuity for all distances and lighting conditions. The lens design's low eccentricity center optics, customized for pupil size, helps eliminate night glare, which is beneficial for patients who experience vision difficulties while driving. The CV4 multifocal design is suitable for all presbyopic patients. Add powers available up to 3 diopters can even satisfy the near vision needs of advanced presbyopes. The front progressive GP design can prove more comfortable than many of the thicker segmented designs. And for patients currently wearing GP lenses, it's easy to make the switch to the CV4 lens. The CV4 is an excellent choice for presbyopic patients with astigmatism, since toric optics can easily be incorporated. The progressive optics provide intermediate vision, making them a great choice for patients who spend numerous hours on the computer, which includes just about everyone today. The CV4 multifocal lens has a base curve range to accommodate most corneal shapes. All distance powers are available from plus to minus 20 diopters, with add powers up to plus 3 diopters. While we recommend starting with a 9.5 millimeter diameter, any diameter can be ordered between 9.2 and 9.8 millimeters. We suggest using Boston XO in fitting the CV4 multifocal lens design, but the lens can also be manufactured in Boston ES, Boston EO, Paragon HDS, Fluoroperm 30, and Paragon Thin. The CV4 is an obvious first choice for existing GP lens wearers with emerging presbyopia. Simply verify the distance prescription by over-refracting the patient's current lenses. Next, evaluate the lens position. If the current GP lenses are well-centered, the patient is certain to be successful in the CV4. If the current GP lenses are not centered, make sure to describe the lens positioning to the X-Cel fitting consultant. Measure the patient's pupil size in normal room illumination. Now, call our consulting team to design your new lenses. Provide the patient's current GP lens parameters, the distance over refraction, the add power, and the pupil size. Based on this information, lenses will be designed and ordered. Since the CV4 multifocal can also be fit empirically, no diagnostic fitting sets are necessary. Simply use the patient's pupil size, Ks, and spectacle Rx, and follow the base curve selection chart. With our fitting guide and fitting tips, it's easy to incorporate the CV4 multifocal lens into your busy practice. Let's review the fitting steps. Always begin with the current spectacle prescription in minus cylinder form. The corneal curvature can be measured with a keratometer since topography isn't necessary to fit the CV4 multifocal. Start the fitting process by measuring the pupil size of each eye in normal room illumination. This is a pupil size dependent lens design, and it's critical that an accurate pupil size is provided to ensure a successful lens fit. Use a PD ruler or the pupil diameter guide provided on the CV4 fitting guide. Taking pupil size into consideration is imperative to designing a lens that optimizes lens power for the patient at all distances. If the pupil zone is too large for the patient's pupil, they'll have difficulty reaching the full add effect. Conversely, if the pupil zone is too small, the patient may experience blur for distance and intermediate areas. Next, use the selection chart to determine the base curve based on the amount of corneal astigmatism. For spherical corneas, fit the lens on flat K. If corneal astigmatism is between 1/4 and 1/2 diopter, order a lens 1/4 diopter steeper than flat K. If there's 3/4 of a diopter or more of corneal astigmatism, a base curve 1/2 diopter steeper than flat K should be chosen. For amounts of corneal cylinder greater than 3 diopters, please call our experienced lens consultants for fitting advice. The CV4 lens is available in diameters ranging from 9.2 to 9.8 millimeters. However, for the average cornea, which measures between 11.5 and 11.8 millimeters horizontally, a 9.5 millimeter diameter lens is recommended. This diameter helps the lens to center and enhances patient comfort. Choose a 9.5 millimeter diameter lens for all eyes, except those with unusually small or large corneas, where a diameter of 9.2 or 9.8 millimeters respectively is indicated. Select the distance power using the full spherical power from the Spectacle RX. For sphere powers over plus or minus 4 diopters, vertex the distance power of the spectacle prescription to the corneal plane. Next, adjust for tear layer effects depending on the base curve selected. When fitting steeper than K, compensate for the tear layer effect with minus power. Select near power using the full add power from the Spectacle RX. Finally, order the lenses by supplying the laboratory with the patient's pupil diameter, lens base curve, diameter, distance, and near power. That's it. Let's review these fitting steps with an example. The patient's spectacle prescription is minus 2.5, minus 3/4, axis 180, with a reading add of plus 1.5 diopters. The K readings are 43.25 diopters at 180 by 44 diopters at 90. Begin by measuring the patient's pupils in normal room illumination. As a point of reference, 4 millimeters is an average pupil size for patients in the early to mid stages of presbyopia. Next, note that the difference between the flat and steep corneal meridians is 3/4 of a diopter. Under these circumstances, the fitting nomogram suggests that we start with a lens 1/2 diopter steeper than flat K. Given this information, we would place an order with the following parameters. Pupil size 4 millimeters, 43.75 diopter base curve. If the patient's corneal diameter is normal, order a 9.5 millimeter lens diameter. In this case, we'll adjust the distance power to minus 3 diopters since the lens is being fit 1/2 diopter steeper than K, and the add power is plus 1.5 diopters. When the lenses are dispensed for the first time, allow them to settle up to 20 minutes before evaluating vision. Test the patient's binocular distance and near visual acuity. Both distance and near vision should be evaluated with the patient holding his or her head in the straight-ahead position. If an over-refraction for the distance and near vision is necessary, always use handheld trial lenses instead of the 4-opter. Testing in this manner is more indicative of how a patient sees through their bifocal contact lenses and allows reading objects to be held in their natural position. A centered lens is the desired fitting position, along with a slight lens translation upon downward gaze. If this is not achieved, the problem-solving techniques that should be employed are the same as those used when troubleshooting single-vision spherical lens fits. When observing excessive lens movement, consider a steeper base curve. If the lens is not positioning properly and a change in base curve doesn't improve centration, increase the diameter. Keep in mind that base curve changes should be at least a half diopter to be effective, and diameter changes should be at least 0.3 millimeters to see a result. If the patient is experiencing poor near acuity, even though distance vision is good, check the translation of the lens first. Make sure the patient is holding her head up while looking down to read. If she's tipping her entire head down toward her reading material, the peripheral lens area won't position properly over the pupil, and good near vision will be difficult to achieve. If the patient has good distance vision, lens centration and translation are adequate, but still has difficulty with near vision, consider decreasing the pupil zone size. Now let's talk about good near acuity with unacceptable distance acuity. First, check to make sure the lens is well centered so the pupil zone positions over the pupil area. A lens that rides up too high or down too low can blur distance vision. If this is the case, choose a different base curve or increase the diameter. Next, check the over-refraction to make certain that the calculations were correct. It's critical not to over minus or under plus at a distance to ensure maximum reading correction. If neither of these work, next consider increasing the pupil size. The CV4 lens design has a no-risk warranty. Within 90 days, there's a 100% credit on 2 exchanges per eye and cancellation. Still not sure what to do? Call or email our experienced fitting consultants. We're eager to help you be successful with the CV4 multifocal lens. Place your order with the X-Cel branch nearest you and try a pair today. X-Cel Contacts, innovators in GP lens design and manufacturing.